Thank you so much. Good evening, everyone. Thank you for being here and spending basically the start of your holiday week with us for the next hour or so. Um, just wanted to give a shout out also to Assisi Animal Health. They have been phenomenal partners with us, educating our profession throughout this past year, and this year that we are finally close to closing out. It's been quite the year. I applaud each and every one of you for sticking through it and for all the work that you do. You truly are frontline workers as well. And all of our pets are much better for that. So thank you. And thank you to Assisi. So we know that dogs are social animals, and really by nature, they prefer the company of people or animals to solitude. And even dogs that are appearing to be independent, they really base that independence on the fact that they know that the pet owner isn't very far away. And as many of us know, there's a world of difference between dogs who wander to a quiet spot in the house and those who are left alone for hours as owners go to work, run errands, or participate in social activities. And so we also know that some dogs we're going to see different personalities from dog to dog, right? So we're going to see some dogs that are deeply indifferent about human comings and goings, as long as, their gastric and excretory needs have been met. And you can see that on the left hand of the slide. And then others, which may not be entirely indifferent, resign themselves to the inevitable and sleep through the day. There is a problem, though, when dogs left alone are significantly distressed, as we're, starting to see in the dog on the right. And so canine separation anxiety is the clinical diagnosis that's applied to a whole variety of behavioral issues that have one thing in common, and that is that the dog has been left behind, left at home, not going with the pet owner by its human. It can present in several different ways with a whole range of intensities, as I'm sure many of you have encountered. Affected dogs may exhibit their distress by destructive chewing and digging. This is typically seen at those exit points, so windows, doors. Also, urination and defecation in the house, whereas when the human is home, when the pet owner is home, they know they are house trained. And then persistent vocalization would be another clinical sign. And so, some owners, and you've probably heard this, are absolutely convinced that the destructive behaviors are purposefully directed toward them because the pet is retaliating about being left alone or being confined. Part of the reasoning for this is due to the fact that the objects that are commonly damaged include personal items belonging to the pet owner. And that can be anywhere from books, clothing, shoes, even sofa cushions. What these objects have in common, though, is that they're frequently handled by the owner and they carry the owner's scent on them. So contact with those items that that they have and then they're destroying, as you can see in this image, are items that serve to remind the pet of the absent owner. That reminder, and the owner isn't there, then causes anxiety that triggers destructive displacement behaviors. So unless evidence is left behind, like we just talked about, unless the owner can see the destructive behavior or see, that the dog has defecated or urinated. Some owners, if they're not seeing that, then they may be completely unaware of their pet's distress. So understanding what dogs do when they are alone is important, because at least 50% of dogs exhibit separation distress, and probably even a higher number. And this 50% exhibiting these signs or this distress is over the lifetime of the pet. So there we go. So we know that 17% of dogs, roughly 13 million dogs in the US, are affected with canine separation anxiety. There's a significant disruption of their daily schedule. And we see a whole age range, okay? We see from young dogs to old dogs. And there's no gender or breed prevalence. Approximately, again, it's about 17% of those pet dogs that we see in veterinary hospitals, and they are believed to suffer from separation anxiety. There are, as I said, no notable differences between genders or breeds in regard to risk of development of separation anxiety. But studies have indicated that there are significantly more mixed breeds and dogs that have been adopted from humane societies or shelters, and dogs over 10 years of age that present for this problem. So, diagnosis. This is obviously your realm. You as the veterinarian are going to make the diagnosis. I, as a veterinary technician, I'm going to help collect the data to get a history, etc., and work then with you, give that information to you to help come to that diagnosis. But diagnosis is typically confirmed using videotape or even audio taping. And this is done, obviously, when the owner is absent. A dog with separation anxiety will chew, vocalize, pace, or even eliminate only in the owner's absence. Typically, this occurs immediately after the owner leaves or within 30 minutes of the owner's departure. Additionally, the dog will appear distressed rather than bored or playful. Distress will typically be accompanied by, what we see as pacing, whining, panting, and restlessness. It's really critical for us as a veterinary team to evaluate their overall behavior. So, so when looking at their overall behavior, there also may be other concurrent forms of fear or anxiety, and those might be caused by medical problems. Perhaps it's an older dog with cognitive dysfunction syndrome. Perhaps they have some type of behavioral pathology that then leads to anxiety and specific anxiety states, such as thunderstorm phobias. So we know that canine separation anxiety has a big impact on the human-animal bond. It creates a high level of stress in affected dogs and in their owners. It can have obviously a huge impact on the owner's life as well, to the point where the owner may opt to stay home when when more owners were going to work, but you know, we do still see, even in the time of the pandemic, owners going to work and um, dogs having canine separation anxiety. So what results from that is, because these are family members, right, to us and to the pet owner, they actually opt to stay home 7 days a week to avoid this unwanted behavior. And the fallout from separation anxiety, especially if it's accompanied by destructiveness, may lead to relinquishment or euthanasia. So treatment really should be aggressive, but planned with caution, because we don't want to add to this dog's anxiety, right? We want to help manage it. Obviously, you're going to prescribe a treatment plan, and we're going to work with the owner and with the dogs to manage canine separation anxiety while not adding to that. I hope that makes sense. So medical workup, obviously, we're going to do a complete history. We're going to take a physical exam. We're going to ask some behavior questions with a questionnaire such as you see on the screen there. You know, has there been destruction in the pet owner's absence? Is the dog eliminating indoors where they are completely house trained? And you know, right on down. Unusual dietary habits, so they're not eating or eating at different times, or even you know, eating almost like pica behavior, so eating things that they typically don't eat. All of those we want to know, and your veterinary technicians should be asking. So again, that's why I like checklists. I think it makes it easier to work with the owner and to ask questions, especially if they're open-ended, and get those owners really opening up to us and answering the questions, telling us about what their dog is, what's happening really with their dog at home. So we talked about the initial step being the medical workup. You guys all know that, and a full physical exam. And then, depending on the specific behaviors and the physical exam findings, we may also then, or you may also then, be doing a full neurologic exam, a chemistry panel, a CBC, thyroid, fecal exam, and a urinalysis, which truly are trying to rule out any medical issue that could be causing the signs that the owner is seeing. So we get through all of that, and you as the veterinarian are coming up with the treatment plan. And it really should be aggressive, but again, planned with caution, because we don't want to increase anxiety in the dog. So the successful management of separation anxiety includes teaching the dog to tolerate owner absences and correcting the specific problems that the owner has videotaped or has been, you know, discussing with us: chewing, scratching, digging, barking, etc. One study found that the fewer instructions the owners were given, so what does successful look like for the owner? Fewer instructions result in more compliance and more improvement in the dog's behavior. So really, a simplified program that deals with proper homecoming and departures, teaching relaxed independence away from the owners, and decoupling departure cues from actual departures in combination with drug therapy, that has shown to improve the majority of problems. So really, it's termed a simplified program, but we know it's not simple. This is going to take some time. It's going to take the vet healthcare team truly working with that owner and with the dog. And it's going to take a lot of time and patience to teach that relaxed independence when the owner is away. So simplified is relative, right? So what we want to do, as I mentioned, is decouple departure cues from actual departures in combination with drug therapy, or in combination with Calmer Canine. So it's going to again be, as we've talked about many times now, a multimodal approach combined with drug therapy, as I said, and targeted pulsed electromagnetic field therapy. What we want to do, what we really need to do, if you think about psychology and behavior and cognition in dogs, is we have to set that dog up for success, just like humans. We want to set humans up for success. So during behavior and environmental modification, we want to have the owner make arrangements first to avoid leaving the dog home alone. Okay, so again, we don't want to add to the stress. We're going to work on these cues, but the owner has to agree to a period of time where they're going to be able to work with us with these behavior and environmental modifications. Owners may take their dogs to work, maybe arrange for daycare, or leave them with, a neighbor or a friend, someone that the dog is comfortable with. Well, crating might seem to be an easy solution for elimination and destructiveness. In most cases, it's not going to be recommended because the dog may attempt, as you can see here, to escape from the crate and cause some severe injuries to themselves. I mean, look at this. That is a thick piece of plastic that was on the bottom of that crate, right? You guys know it as well as I do. And look at the destruction that poor dog did. So if we're going to use a crate, that might ultimately be possible, but we're going to have to introduce it slowly while the owners are home. And for first time uses of a crate for an inexperienced or truly anxious dog, we're not going to use crate training. Or crating, I should say. So gonna leave the crate for right now because we don't need to add again to the anxiety. What we want to do instead is create a safe haven. Okay, so if the dog is a barrier anxious or a digging, chewing, scratching through distress behavior dog, then what we want to do is have the dog themselves identify a dog-proof area, such as the kitchen, mudroom, maybe even a spare bedroom. And this is going to be the safe haven. So the safe haven is a space where the dog on its own chooses to sleep at times. And then once that area is identified, we're going to have the owner, hopefully they truly are committed to this. And to create a safe haven, then we need to have the owner get a tall, securely bolted and easily open gate for this safe haven, because many dogs panic when the door is shut. So we can start with the gate open. They can see through the gate. We don't want a solid panel. Okay, we want something similar to what you see there. We're looking at 2 Labrador retrievers. Obviously, it can be shorter with the smaller breeds of dogs, but it starts by finding a place that the dog is comfortable with and the dog chooses to sleep. And then again, easily open gate for our safe haven. Then we're going to look at initiating some medications. Dogs with separation anxiety are stressed. They're oftentimes traumatized with an impaired ability to learn new tasks. So while we're talking about, behavior modification, and we know that it can be effective in managing separation anxiety, we really need to think of anxiolytic drug therapy, obviously, coming from you as the veterinarians, because that's going to help facilitate treatment and, in many cases, reduce anxiety more than training or management changes alone. So, drug therapy, as you guys know, is commonly used to assist with behavior modification, and it's both humane and helpful. If they're stressed and we're not managing that stress from a medication standpoint, then how are we going to introduce behavior modification? That's why anxiolytics, which you guys know, should be started as part of this multimodal therapy. We know a daily drug administered, whether the dog is going to be left alone or not, can effectively raise a dog's threshold for distress. And two drugs have been approved by the FDA. You know this better than I do, Reconcile and Clomicalm. And I'm going to leave the medication stuff to you. So, because that's your area, not mine, obviously. So journals and videotapes. We want to, and we need to establish a baseline, right? What is that particular dog's baseline for panting, pacing, urinating, or defecating, and those signs that we talked about? And we also need to determine a baseline for, how long and how intense those signs are. And so we need to, we're going to develop this baseline to determine whether treatment is working or not. And a video camera can be aimed at areas where elimination or destructiveness has occurred. Typically recording 30 to 60 minutes is going to give us a reasonable idea of the dog's distress after departure, after the owner's departure. If they are primarily a barking separation anxiety, then we can use audio tape. And then video or audio taping should be repeated as needed to monitor how the pet is doing. Journaling is also crucial if we can, again, encourage and get the owner compliant, because a journal of the dog's behavior is going to, again, help us with how things are going during the treatment, and it should include elimination behavior outdoors, as well as when the owner leaves the house and returns. So dogs that cannot adapt to being separated when the owners are home are going to create even a more sticky situation, because they might be less likely to tolerate the owner's actual departures. So to encourage independence from the owner, we want to provide a mat, an open crate, or a safe haven room where attention is offered when the dog is calmly sitting or lying down. This can then eventually be used when the owner actually departs. Also, to help manage hyper attachment, food dispensing toys. So a Kong toy, or some of the food puzzles, things that you see on the screen here, are great to not only distract, but also to counter condition. So anxious dogs may benefit when their food is fed from food dispensing toys such as this. It truly stimulates their brain, their cognition, and gets them focused, behaviorally speaking, on something other than the pet owner leaving. Just one other thing on that. We should definitely be offering these toys at different times. So they're not then conditioning themselves to, I get this toy when the owner leaves, and then they'll be stressed by that toy. So these should be given when the owner's home, when the owner maybe is outside, etc. Because we don't want this associated with a stressful event, and then it becomes a trigger for anxiety. So if we want to habituate to cues of departure, this is going to take a little bit of time, but again, it's in the best interest of that human-animal bond. Desensitization can be helpful for dogs that become reactive at the moment of departure. So when owners walk to the door, when they open the door, and then they walk out. And once these dogs have been taking that daily anxiolytic that you prescribe for at least a month, and they've learned to manipulate those food dispensing toys in their safe havens, that is when now we can start to help owners begin the desensitization process. This technique introduces repeated exposure or habituation to departure clues, okay? And such as picking up keys, turning off lights, putting on their coat. And it's going to help dogs disassociate those cues from actual departures. And so again, anxiolytics for a month. They've learned to manipulate the food dispensing toys. They have their safe havens, and they are involved with their targeted pulsed electromagnetic field therapy, which we will also talk about. So habituating to cues of departure. We need to, again, repeatedly expose the dog to these departure cues. So picking up keys, but they don't leave. Okay, they pick up the keys, they maybe walk around the house. They turn off the lights, but they don't leave. So we're trying to break that cycle where, okay, normally we'll go to the door, we'll pick up our keys, we'll turn off the light, we'll open the door and walk out. All of those are cues that will cause increased anxiety because the dog knows their owner is leaving. We need to desensitize the dog to those cues. So we're going to change the ritual. We're going to change things up, and we're going to encourage the owner, or their treatment plan is going to involve them leaving through a different door. Maybe they're not going to put their coat on before they leave. They're going to put their coat on in the garage. Maybe they're going to park down the street. Okay. What we're really doing is changing things up. So it's not the same routine that then the dog stresses. So the departures, once the dog has responded well to those simulated departures and changes in departure cues, then we can begin working with owners on desensitization to actual departures. At first, they should be very brief, and the owner should not truly leave. Maybe the door can be approached, touched, opened slightly, and then closed. The duration of the departure should be determined really by videotape. So if the owner leaves for 5 minutes, but the dog is calm for only 3 minutes, then 5 minutes is too long. Okay, and the time should be shortened. Depending on the dog's tolerance, the first actual departure may last from a few seconds to a few minutes, with the length of each subsequent, practice departure gradually but randomly increased. So again, we need to start getting them used to differences, but we don't want to, do the same thing because we're just going to result in the same problem. So we're not going to always approach the door and touch it the same way. We may open it a little one time, open it more the next, and we're going to also change up the time. Okay, so it's important also for us as veterinary team members in working with canine separation anxiety dogs to realize that breaks in the dog's calm behavior, such as rising, the dog approaches the door anxiously, starts to vocalize or just starts to act nervous again. We need to realize that session went too quickly. And we want to end the session after a few successful shorter departures. So we're going to, shorten it to the point where there are some successful behaviors from the dog, and that's when we're going to end it. We don't want to end on an unsuccessful departure cue or habituation cue. Okay. And so we're going to have the dog participate in some less challenging exercises because we want the dog to be successful. We want to really try to minimize the difference between owner presence and owner absence. And so how are we going to do that? Well, to decrease the impact, owners should not change noise levels. So, if they have the radio on during the day or the television, leave that on. If they have their lights on, when they're home, then they should leave their lights on when they leave. It also includes minimizing owner-dog interactions prior to the owner leaving and returning, right? We all do that, but for some dogs, that's not good. If the dog picks up on the fact that the owner's coming over and saying, "Oh, I'm going to miss you so much," and then they leave, that becomes a cue then. And the whole thing falls apart. And psychologically speaking, the dog will go back to that separation anxiety behavior. So also, a white noise machine really can help muffle outside noises and provide background sound. Dogs actually really like classical music, and sometimes they get used to talk radio. So whatever the dog enjoys, whether it is a white noise machine or, hard rock, if that's what they're used to, it's okay for the owner to be playing that when they leave. We have to remind the owners to avoid punishment. Okay, we don't want them punishing the dog for anxiety related behaviors. And by definition, punishment is an unpleasant or aversive, sorry. Whether the dog is chewing, digging, all such behaviors are manifestations of distress. So if the owner's arrival home is associated with punishment, or the owner suddenly opens the door to shout at or otherwise attempt to discipline the dog, that anxiety can then be so much worse. The guilty look, that guilty look that we all hear from owners, indicates that classical conditioning has occurred. The dog now associates the presence of urine, feces, or destroyed items with the owner's arrival and punishment. So typically then the behavior is going to recur the next time the owner leaves. So reprimanding the dog for bad behavior hours after the behavior takes place does nothing to prevent the behavior from recurring in the future. And we have to remind owners about that. So interactive dog cameras, those are great. It really helps the owner to see what's happening at home, to see if the desensitization has worked and is continuing to work. And there's all kinds of them out there. This is one, a Furbo, but I mean there are all sorts of different interactive cameras to watch pets. And then what else is going to help? In addition to our behavioral modification, exercise. Frequent exercise sessions have a very calming effect. They help to decrease anxiety and provide suitable social interaction. It provides vigorous aerobic exercise 2 to 3 times a day, and that can have a very good effect on separation anxiety and anxiety in general in dogs. It's releasing those feel-good hormones, right? Serotonin, dopamine, the endorphins. So as much as owners don't like to hear about exercising their dog, it's another part of the multimodal approach to canine separation anxiety. So let's get them moving, right? I mean, we all know the benefits of exercise, especially in our animals, and we also know, in addition to canine separation anxiety, that we are facing an epidemic of obesity. So it's a win for everyone if we can get the owners moving with their dogs. And it doesn't have to be a marathon, right? Even just, a small walk or throwing a ball or just, moving around the house even. We just need to get them moving more than they have been. So calmer canine, we mentioned this as an additional part of the multimodal approach. And the Calmer Canine is a highly innovative, gentle, effective, safe, and drug-free treatment system specifically for canine separation anxiety. The Calmer Canine device delivers targeted pulsed electromagnetic field signals to the area of the brain responsible for causing the symptoms of anxiety. It effectively returns the anxious brain to a more balanced emotional state with long-lasting effects. And early evidence has suggested that calmer canine may also help dogs with other types of anxiety and fears, again, such as noise sensitivity, travel anxiety, thunder phobias. It's another tool for us to use in our multimodal approach. And so we know that an anxious brain is out of balance. And as the fight or flight center, the amygdala is the area in the brain responsible for producing fear and emotional responses, which express themselves as signs and symptoms of anxiety. As I said, an anxious brain is out of balance. With an overactive brain, cells that are then producing harmful substances causing inflammation and cell death instead of beneficial substances that reduce inflammation and protect the cells. Working at the cellular level, Calmer Canine sends that targeted pulsed electromagnetic field signal to the brain to increase the production of nitric oxide that then helps to reduce inflammation. The signals also cause the neural cells to produce those feel-good substances that we just talked about: serotonin, dopamine, and endorphins. It's a pretty amazing tool for us to use in conjunction with exercise and with behavioral desensitization. We also know that the treatment system, the Calmer Canine treatment system, includes a comfortable and easy to use vest, as you can see here on this beautiful pitty, that holds the device in the proper position over the dog's head during treatments. And typically it's 2 15-minute treatments a day for 4 to 6 weeks have been shown to significantly reduce signs of canine separation anxiety. And those signs are just the ones we've been talking about. Barking, whining, howling, destruction, pacing, staring out the door or the window obsessively. And these reduced signs last. So it's not a one and done. These signs this reduction in signs have lasting effects. So Calmer Canine, we know, significantly reduces the signs that we see in canine separation anxiety. And you know what? It improves the quality of life. And isn't that why each one of us got into veterinary medicine, right? It increases the time the dog spends playing, grooming, and resting when they're home alone, instead of being so anxious that they, are destroying or eliminating in the house. The results have been shown to last after the therapy has been discontinued. In addition, the effects of the treatment continue throughout the day and between treatment sessions. And as I mentioned, Calmer Canine may also help with other anxieties. The treatment is well tolerated. It's sensation-free, which is also important because we don't want, again, we've been saying throughout this, we don't want any of the modalities that we're using to cause further stress and then increase the entire separation anxiety or anxiety in general symptom. So they're not feeling anything. It's sensation-free. It's very gentle, and it is effective as a standalone therapy or in a multimodal approach. And that's what I love about, veterinary medicine is we're open to, and we should be open to using so many different tools that we have to help address a problem and help to work to improve that human-animal bond. So when we're preventing separation anxiety, some time should always be spent by, and I encourage you to use your veterinary technicians, discussing similar situations in the future that may trigger a recurrence. And so we want to avoid that, ahead of time. And so when the owner anticipates a significant alteration in their schedule, or maybe in the amount of time that they're going to be able to spend with the dog, then that changeover should be made as slowly as possible. We want to make those changes very gradually in a way that can easily be tolerated by the pet. Medication, again, might be considered as a preventive, but it should be started at least 4 weeks prior to the major change. We really want, a little forethought will help prevent the anxiety that can develop in association with those sudden major changes in the pet's life. We know that they're going, changes happen, and change is hard on everybody. If we are aware and if the owner knows that a change is coming, let's work with them to make it easier on their pet. Remember that dogs are social animals. They truly do prefer the company of people and other animals. And that canine separation anxiety is a clinical diagnosis, and it's a variety of behavioral issues. But the one factor that is the diagnosing factor is that the dog is left behind by its human. So We want to work with our pet owners to help rebuild that human animal bond, right? We don't want the bond to be disrupted or broken, and then have the dog end up either euthanized or in a shelter. We can use our multimodal approach. You saw that there are a number of tools to help work with the uh, with the pet owner to rebuild that bond, to rebuild that human animal bond. It will take patience, and that's why this is a team approach. Obviously, you as veterinarians are going to be prescribing, so you're gonna come up with a treatment plan. But we as a team can then help and work with the pet owner and the pet themselves, because it will take a lot of patience. It will take a lot of work from the whole team, and it will take patience from us as veterinary team members, as well as from the pet owner. This is what we're trying to get to, right? Where that dog is very comfortable, whether we're there or whether the owner is there or not. So we have a number of tools in our arsenal, because it is a multimodal approach. I know I've said that a number of times, but you can see here, some of the tools. Desensitization, right? We want to habituate to those cues. Medication, which is your area, not mine. Targeted pulse electromagnetic field therapy, aka Calmer Canine. Food dispensing toys, safe havens, right? We have a number of options, and if we put them all together, then we can improve and strengthen that human animal bond. But it will take a great deal of patience.